the entire morning. He's been running around the Bongani Hospital there, and he's been showing us some of the things that have been taking place there, and some of the basically how the hospital is operating at this point in time. So let's join him once again and find out where he's moved to. Richard?
Hi, welcome back to the Bongani Hospital in Welkom. The whole morning we've been talking to people at the hospital, we've been looking at the services offered here, we've been speaking to patients, we've spoken to the MEC, and we've been having a look in general at the challenges facing the healthcare in this province. We've been looking at what needs to be done and what has been done, and we also had some members of the community here who were talking to us about some of the issues that they wanted raised, and we had a number of complaints. We had a number of people who were saying their experiences were fairly good. So it's been a mixed bag, and I think that sums up in quite a few words how it's been. And with me now we have a community member who's just come out of a community meeting. Ma'am, you came here as part of the community to talk about health services. What has been your experiences?
Nna ka nnete ke na le bothata ka sepetlele sa Bongani haholo. A re fumane di-service tse nepahetseng, di-service di a shorta. Ha o ya ka toilet o tlile mona sepetlele ha o fumane tissue, re a khutliswa le di-clinic tse around to treat ke le dinetlele ha o batla tlo hlaba spate. So ka nnete service yona ha entle total. Re dula nako e telele ka ga sepetlele because manese a shorta.
Okay, what the lady's been saying is there's no tissues in the bathroom, there aren't needles when there need to be injections given out, and not at all happy with that particular service. And as we've been speaking to healthcare professionals, we've been told that this particular hospital where these complaints have emanated deals with 600,000 people. They've admitted that there is a high workload, that they do struggle to deal with a lot of the overflow they get from other towns in the surrounding areas. And we've also today heard about the shortage of doctors and how that is an ongoing problem, and we need to be encouraging people all the time to get into medicine, to get those training colleges up and running for the nurses and so on. So I think the message we're taking from today, from this the visit we've had here today, and the information we're getting about the media tour that's been held all week throughout the province, is that yes, there's some great work being done by medical professionals out there, and there's also some areas that need urgent attention. And we've had commitments from the MEC, we've had commitments from others in the department that they need to look at these areas where assistance is needed, where perhaps they need to sharpen up some of the workforce, and use those best case scenarios, use those best examples, and apply them in other hospitals as well. So I think what we're looking at here is a snapshot of the country, using the Free State as an example, that yes, a lot of challenges and needing to be dealt with, and the work is being done to deal with them, and that's what we have from the Bongani Regional Hospital. As we said, a massive hospital dealing with over 600,000 people from 5 different towns, and that's what we have from the Bongani Hospital. And from this area, from the Goldfields, it's back to Johannesburg.